This video explains how to use the Arclight to perform the Fundal red reflex. Prepare the Arclight by selecting the brightest light setting with 3 clicks. Make sure the lens rack is at the top where there is no lens power in the sight's hole. The examination room needs to be quiet and dim, so switch off the lights or cover any windows. Get the sight hole close to your eye and at arm's length observe the reflex in both eyes at the same time. In a darkened room, most babies and young children will naturally look at a light, compare the brightness and color between the two eyes. Move side to side a little and get closer if you need to look in more details. The appearance will vary depending on how far away you are and where the child is looking. In a black baby, the reflex typically looks yellow and white and sometimes even blue. Importantly, in a normal examination, there should be no overall difference in the brightness and color between the two eyes. If you feel unsure about the color or the reflex compared to a parent, it should look similar. If you are still unsure about the appearance or the examination, then ask a colleague for a second opinion to help you. If you are on your own, then consider recording a video of the reflex by attaching the Arclight to the camera of your mobile phone. After gaining concepts, record the reflex and share securely for a second opinion. The color of your reflex can be different between races. In white and Asian babies, the reflex can look more orange and yellow. These appearances are still all normal as the overall color and brightness is the same between the two eyes. Assessing a newborn baby is different and can be harder. Mother should hold the baby swaddled securely with the arms tucked away. If the eyes are open without touching the baby, try to observe the reflex in both eyes at the same time. In newborns, the pupils can be smaller. They are less likely to look at the lights and their eyes might not be straight. Occasional and short-lasting squints are common in the first month of life and will usually disappear by 3 months of age. Reflex in newborns can look paler compared to the older children. If, however, the overall color and brightness is similar between two eyes, then the examination is normal. Many newborns will, however, be asleep, and to see the red reflex, you will need to gently open the eyes with your finger one at a time. This way, it is usually not possible to compare both at exactly the same time, but instead look at one then another. A calm, gentle, and patient approach is important. Sometimes you may also notice birth hemorrhage on the white of the eye. These are common and will soon disappear. If you think the reflex is abnormal, then ask a colleague to also check. If no one is available or you are on your own, then after gain concepts, consider recording a video to share with the colleague. After the examination, repeat hand washing, thank the parents or care, and document and explain your findings. Agree a clear plan for further assessment if needed.